Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Marigal Medical. This week we're going to be talking to you about patients that have been coming into the office with multiple complaints. So if you're diabetic, if you're overweight, if you have symptoms of neuropathy, and then you have joint pain, what do? Do you go to 5 different specialists? Well, we have the solution for you right here. You're going to want to stay tuned. Okay, Dr. Mike, I am so excited. We've got medical weight loss, lifestyle medicine off the ground. It's been our first month. We have 10 patients that are going through the program. They are doing outstanding. And you're gonna wanna make sure you check out the information about our medical weight loss program, NutriHealth, at the end of this video. But more importantly, you and I have been talking about just the level of confidence that we have in the clinic now with all types of patients coming into the office. And now we're seeing those more complicated patients where they have a multiple amount of different symptoms and conditions, where you have diabetes, neuropathy, joint pain, they're overweight. You know, what do? We don't have enough hours in the day to go to a million specialists, but we can take care of all of that right here at Marigal Medical.
That's no question we can, and the concept is we're seeing that profile of a patient. So many people may have heard what's called metabolic syndrome. So what does that mean in the endocrinology world? A person is diabetic, they have heart disease, they have high blood pressure, and all the processes that go along with this combination of diabetics and heart disease and things. Well, in the musculoskeletal world, along with the neuropathy issues, we see those same patients in a multitude of problems that come along on the musculoskeletal side. And it's a syndrome caused because they have chronic disease of chronic inflammation. So we've always talked about the chronic inflammatory response, getting people healthy internally, and again, we treat people inside and out because we're trying to get their inflammation down, their diet, their aspects of weight, again, reduction and aspects of health. Well, that person becomes prone to diabetes with neuropathy, diabetes with arthritis, arthritis with being overweight. And you start putting all these patients together that we see and take care of every day, they have all these symptoms because it's just one thing leads to another. So we're really putting a program together that really focuses on that person who has the multiple medical specialists, and we can do it all here.
Yeah.
Why go to the orthopedist? Why go to the endocrinologist? Why go to your primary care doctor? Why go to the cardiologist? Well, you still might need those specialists, but we can put it all together to work on the program to get them all those problems under control.
Yeah, and I think as a patient, you'll be more than satisfied. You know, I think what sticks out is a patient yesterday that you had seen, and with all the emphasis on the new medications out there for weight loss with Ozempic and Wegovy, this patient in less than 10 minutes, without going into any detail about, what their diet looked like, was given a prescription of Ozempic. And it's just insane to me that you wouldn't even spend the time. But, unfortunately with our healthcare system, the primary cares are overburdened. They can't solve these issues in 15 minutes. But one of the benefits in our clinic as a private practice, we have that luxury to set our own schedule. You'll be able to, sit with Dr. Marciello and go through all of your problems and get them addressed under one roof.
Yeah, this patient, again, is a perfect example as you just brought this up. So the person's overweight. They're coming in for us what they feel is a musculoskeletal clinic. They have some joint pain, their back problems, physical labor work in the past, but realities are the medical doctor identifies the risk factors, and we all want to try to prevent injury, prevent disease. Well, the primary care doctors will say, well, get your weight down, stop smoking, do these things. So, but the traditional system is, let me give you the prescription to get the weight off, thinking that that's going to solve his problems. But when I spoke to him, the doctor didn't even ask him what he's eating. He's telling me that, he's a junk food eater, and he's eating bags of chips and late night cookies. And well, that's where we stop. And we say, we got to get to the root cause. Let's change the dietary process, and then maybe we'll take a nice slower route, get that back pain under control, because we work on his weight control as well. So we really want to take that holistic approach. That's what we call our lifestyle medicine approach, right? We're changing behavior, We're looking at the aspects of health and wellness because there's exercise, there's dietary control, there's smoking cessation, there's aspects of controlling your behavior and function. And again, the concept is that's where we want to focus on getting these patients under control, not just another prescription.
Yeah, emphasizing getting to the root cause of your problem. If you know somebody out there that is suffering with chronic pain, chronic inflammation, that is overweight, that has diabetes, or symptoms of neuropathy, you're definitely going to want to pass our information along to them. We've got a wealth of information on our website at marrowellmedical.com, and certainly our weekly YouTube page has grown tremendously. We've got quite a library there of different health topics that you can refer over to. And don't forget, we just launched our medical weight loss lifestyle medicine arm to our practice. All patients are invited for a free consultation with myself to learn more about that program. Well, that's it for today. I hope you learned something. Have a great day, everyone.
Be well.